the live stream up and running? Okay. Well, we are recording as well. Good morning, everyone. Welcome again to St. Luke and to today's Adult Forum. Today we're glad to welcome Diane Herbert to speak with us. Diane is the Chief Operating Officer of MooreWays, which is a integrated mental health care outfit in Exton. And Diane speaks and writes a lot about the connection between emotional and physical health in mental health care. And we are glad to hear about some of the new things that they're doing and the ways that they're helping people. So let's welcome Diane Herbert.
Let's start that over. Here we go. Okay. So again, thanks so much for coming out and staying out. I know everybody's got things on their plate for today, game day, and it's freezing. But really an important topic, and I'm excited to be able to share it with you. I'm grateful for Pastor Matt and the congregation here at St. Luke for inviting us back. This was our home church a while ago. Pastor Sue baptized our children, our grandbabies. So St. Luke's has been an important part of our hearts for a long time, and we're glad to be able to share some information that's going on in the mental health field with all of you all. We're a small group. Please make this interactive. It's way more impactful and honestly less boring. If you guys raise your questions, you're not going to throw me off. So if something pops up as I'm going along or doesn't make sense, you want some clarification, just raise your hand and we'll tackle it right there on the spot. So as Pastor Matt mentioned, my name is Diane Herbert. I'm with a practice that's based out of Media, PA, and Exton, PA. It's called MooreWays. So we're going to talk a little bit about integrated mental health care and some new, not so new, but some lesser known treatment interventions that are having a significant impact on the lives of millions. So let's get started with kind of a state of a union. So this is probably not new news for anybody. Mental health is a major health crisis facing all of our populations across the lifespan of our seniors, as well as our young people. So, well over 50% of people are currently living with a mental health condition. Our young people are not spared from this. Statistics are so concerning that nearly 20% of high school students say that they are actively considering suicide. And so while I say this isn't new information, it's important information to carve out some time and revisit how can we address mental health better, more effectively. And given all of this, I know it has touched our family. I'm sure most people in this room have also know someone, they either themselves or a loved one, who is facing a mental health concern. So thank you for being here. When we talk about how have we approached addressing mental health in the past, as a society, we kind of have a drug-first approach, meaning here's a medication, here's a pill. Try that to reduce your anxiety, to lift your depression. The challenge here is multiple. One is it doesn't address it for most people. Fewer than a third of the people who try a medication get response from it. The process of trying and finding a medication is also very challenging. So when you try your first medication, you need to wait 6 to 8 weeks for it to see if it works, see if we need to make it, adjust it to give more or less. And then if it doesn't work, that same period to titrate down, to step down, to come off of it, to try the new one. So months and months are going by. Each time we try a medication, the likelihood for success is lower than the first one. So if you're an individual, you can imagine, who's living with depression or another mental health concern, you already carry a sense of hopelessness and despair. When we keep trying and not getting results, that hopelessness increases. So as we look at that, we really are in a position of saying, we've got to do better, right? We need a better way. More and more people are struggling with mental health concerns, and our current treatment methodology not being effective for the vast majority of them. So when we say we've got to be a better way, it sounds a little trite, but really as a society, and I mean like as healthcare professionals, as resource supports such as the church and other areas of our community, and then family members, what can we do to improve the outcomes for individuals living with mental health concerns? Because as you can imagine, if you are the person living with depression, just getting up and getting through your day is a monumental struggle. So now if we think about, oh, go out and find a new treatment, go out and make the calls to connect with a doctor. Are they accepting new patients? Are they accepting my insurance? That becomes an overwhelming and undoable task. So as we talk to the people in this room, whether it's yourself or a loved one, I applaud you for being here and learning more about how you can take an active role in helping people find treatment interventions that are going to work for them. So here we are. Let's go back. Yeah. So if we talk about finding a better way, I think it's helpful if we kind of step back a little bit and understand what is it that determines our mental health, right? What's contributing to whether we have good mental health or whether our mental health struggles. And it's slightly simplistic, but basically I think we can look at it in three broad categories. So the first of them is our beliefs and thoughts. This is what are we telling ourselves about how we fit in the world? Are we secure? Are we lovable? Are we worthy? So our thoughts and beliefs play a significant part on how we experience mental wellness. The second piece, maybe you guys have heard the term runner's high. So this comes from a collection of feel-good hormones. This is our body's natural drug, if you will, natural antidepressant. We produce a number of, and delivering effective treatments to make sure that we are kind of firing on all cylinders, right? That our neurocircuitry is in place, that our belief systems are supporting emotional wellness, and that our gut biome and our feel-good hormones are producing at a level we need them to. So this is the genesis for our practice, MooreWays. My partner and I, Dr. Megan Moore, formulated, well, we've been in practice in media for 13 years as a traditional counseling practice, but time and time again, we had more and more patients coming to us, doing everything they're told. I'm taking my medications, I'm seeing someone in therapy, I'm following the plan, it's not working. I'm still suffering and struggling. And so collectively, we decided to expand the practice to include interventions that supported each of those three pillars. So counseling, I think we're all pretty familiar with, and we'll talk briefly on the other, which is gut health restoration. And then the last one is something called Transcranial Magnetic Stimulation, or TMS. Just a quick show of hands. Who has heard of TMS? Okay, so let me say this group is ahead of the curve. To have any hands come up is super impressive. We're going to spend the most time on that particular segment, but I do want to just give some overview first before we get into there too far. So mind-gut connection. Why is this so important to us? What is a mind-gut connection? You may have heard, it's becoming more popular in literature, to refer to our gut as the second brain. So why the second brain? Little known fun fact, the gut actually produces more serotonin, one of those feel-good hormones, more serotonin than our brain. So if our gut is compromised, out of balance, and we're not able to produce those serotonin levels, it's going to have a direct impact on our mood and our emotional well-being as well as our physical health. So the gut biome, another thing that's becoming, thankfully, better understood, more talked about. The gut's really central in our overall wellness, responsible for immunity, responsible for disease prevention, but also if our gut lining is compromised or the gut microbiome is out of balance, either overgrowth, undergrowth, deficiencies, then we're not able to produce those hormones that are play such a vital role in how we feel every day. So gut health is a big piece. So we talk about those three key pillars, just to summarize back. We've got how we talk to ourselves and our belief systems. So we can support that through talk therapy, working on challenging those beliefs and also kind of unwinding and understanding some things that we've experienced in the past that might be still influencing how we feel and view the world today. So that's counseling. And we talk about the feel good, our own version of antidepressants that we produce within the body. We can address that through restoring our gut health and making sure that our body is able to produce what it needs to. That third leg in it, the neuroplasticity one, that's the one we're going to dive into and spend the most time on, which is how we affect TMS, how we use TMS to correct that neuroplasticity and that circuitry level. So we've known as a field for a very long time that if we're able to reestablish the activity, the neuroactivity within the brain, that we can positively influence mental health. The challenge has been, how do we do that in a way that's non-invasive, that's safe, and doesn't have the side effects that previous treatments, such as electroshock therapy, ECT, have had. So the underlying understanding that the brain is driven largely by electricity is important. The innovation that came in the late 1990s, meaning we can use the equipment to identify exactly where on you we should target treatment. And that lets us get the best response. So what does treatment look like? How does it go? So essentially, you are sitting, you can see in that picture, yeah. You sit in a chair and you have a helmet that looks a lot like my mom's old hairdryer. Come down, you have a personalized cap that has your treatment plan programmed into it, and then the machine delivers gentle magnetic pulses to the area of the brain, like say if we're talking about depression, that is responsible for mood. And by delivering those magnetic pulses, we're stimulating the activity in that area. So if we did an MRI of a depressed brain and a non-depressed brain, you could very easily see and kind of like put itself back together. So it's the same idea. Often it's referred to as like physical therapy for your brain. TMS, by applying those magnetic pulses to the area of the brain that needs attention and support, we're increasing the activity level. Think of it as like bringing the circulation back to that area of the brain that allows those connections to be reformed and also allows that neuroplasticity, meaning things are looser. What happens when things are looser in the brain? Well, you can think of it as like literally the personality. You know, someone is locked in the way they are. Well, they're locked in partially because they've had that trigger response happen so many times that they've literally mapped a pathway within their neurocircuitry that says, when this happens, I act like this, or I feel like this. And that becomes like water cut.
Lasting effects.
Excellent question. I told you this was going to get way more interesting if we asked questions, and that's a great question. So the answer is it's very varied. So at the start level, once you complete a treatment protocol, which is a series of treatments, and we can dig into that further, some people, it's once and done. They never need to come back, and the depression is lifted, the anxiety, whatever the condition is we're treating. For other people, it is dependent on the severity and also what else is going on for them. So much in the PT realm, we can lift the depression and get it back. But I say TMS fixes depression, but it doesn't fix life. And so the integrated approach is so critical because what that outcome is going to be largely depending on, are we addressing those other two factors as well? So are we also learning skills to manage stress, how to have different relational experiences? Are we doing that work to complement the neuroplasticity that was created and the depression lift that was created from TMS? So it can last as short as 6 months, a year, or it can last forever. So it's very individualized. The other piece that's important to highlight here, and why I liked that question so much, is it becomes something that you know works for you. So if you received TMS and you had a positive result, and as many as 88% of people do get relief from TMS, if you need to use it again, it works faster and better. So if we think about muscle memory, your brain more quickly says, oh, I remember this. This gets it going faster, and then your results return. So it does become something that for some people that need to manage it in a chronic basis, that it is something that they have in their toolkit. We have a set of patients that are very significantly impacted by seasonal affect disorder. In that case, they look to come in and kind of do booster sessions coming into the darker months to make sure that they're in, sort of fortified to get through the winter months, which is an area that's particularly challenging for those individuals. So I hope I wasn't too vague, but it is a very varied response. But like I said, the positive thing is that if it worked once, it's going to work even better the future times. So, yeah. So the question was, we recognize that it is FDA approved, but is it covered by insurance? So that's an incredibly important question. So the answer is, if we're talking about depression, anxiety, OCD, PTSD, and substance use, the answer is yes, with a big asterisk. So all major plans cover TMS, and our practice accepts all major plans, including Medicare. The challenge comes to each plan is a little different in what they consider medically necessary. So Medicare, which is one of the more progressive coverages for TMS, says if you've tried one medication, antidepressant medication, and did not get benefit, then it's covered. On the other extreme, there are certain plans that require 4 medication trials before they'll consider it medically necessary. So a big piece of our work, of my work personally, is to do all of that digging for you, meaning we put together the clinical presentation for the insurance company to advocate for medical necessity. We have peer-to-peer reviews between our psychiatrist and the doctor for the insurance company to get this fully covered for you, for your patient, for your loved one. We would do all of that beforehand so you know exactly how much would be out of pocket or how much would be covered by insurance. There's 2 exciting things on that horizon, because FDA clearance is the precursor to insurance covering it. It's not a in tandem experience, but once FDA acknowledges it, then more and more. So the trend is definitely moving, and Medicare is also a benchmark for many plans to follow what they say is acceptable, and so we're excited that they've brought their threshold down to 1 medication. Last summer of 24, FDA made TMS a first treatment line for individuals 25 and under. Why is this important? Well, it's important because it sets the precedent for the rest of us not 25 and under, but incredibly important because that population is at the greatest risk from the black box warnings that come with the antidepressants that are being prescribed to them. So here we have the medication that has the potential to actually increase risk of suicide and lead to potential suicide. So having medication be the first 4 things you have to try before you can try TMS is really not consistent with the best care models for that population in particular, or for any of us. But the exciting part is that hopefully that will accelerate the change so that we lower that medication threshold and TMS can become a first treatment line as opposed to only after medications have failed. Great question.
Are you familiar with at-home treatment? It's the same process.
Yeah. So the question was, how does this relate to at-home treatments that can deliver neurostimulation? So I think you can think about it in 2 ways. There is now 1 FDA-approved at-home device. At this present time, and I do believe over time, because like every form of technology, the form factor comes down, we know more about it, we're able to put it into a more and more affordable model, et cetera. At this time, the at-homes should be thought of primarily as like the retainer after you get your braces off. So They don't have the same level of strength and focus that a clinic device has or a facility-based device, but it can give you that massage to kind of boost it and keep it going. And so, yeah, I like to think of it as the retainer. Once you get the braces off, it kind of can help keep things touched up, but is not at this moment powerful enough to have the same results that at a clinic facility would do. But that's a great question, because that is the direction that things are heading, for sure. Yes, where is that? Yes, hi. Yes. So that's a very excellent question. So TMS is an incredibly benign, meaning safe. Okay, so the question, thank you very much. The question was, if you have stents, is this a viable treatment? Can you use that? So the overall safety profile for TMS is incredibly, the two contraindications, things that don't work, is if you have metal beyond dental work. Dental work is not what we're talking about, but if you have metal implants from your neck up, that is not possible with TMS because the metal will heat up. So it's those magnets are creating a heat field that the metal in your body. So if you had like a cochlear ear implant or titanium plates from some sort of a trauma event or surgery, and then stents, we have to look at individually to see what year they were, because that determines what the material is from those stents. So there's a little bit of research just from the neck up. Yep, anything going on down here? Not a problem. So metal and magnets, we have to look at carefully if someone has any sort of metal implanted in their head. So, but that does open the door. Yes, go ahead. That does not. So the question was, does that include dental work or fillings? No. So you can have a tooth implant, fillings, braces, anything like that that's in your mouth that's at that dental level is not problematic for TMS. So, excellent questions.
What was it, 80-some% get some relief? What percent get permanent remission?
Right, so full 66% of people who receive the treatment protocol, and these statistics are specific to depression, we're going to slide into other conditions in a little bit, but a full 66 achieve what's called remission, meaning they no longer have any depressive symptoms. So as we go about treating people, that's our holy grail, right? That's what we're after. At first, if we can just make you feel better, that's a start. That's definitely a start. Depression, the anxiety, whatever the condition is really the goal. In this case, this treatment intervention has a superior results, which is 88% of people get benefit, 66 achieve that remission. So it's pretty impressive, especially when you align it against the safety profile of 0 systemic side effects. So when we say, what is a systemic side effect? So you could have a side effect like, if you can imagine sort of this magic woodpecker tapping on your head for a while. Some people might walk away from a long day of treatment and have a slight headache that resolves, that goes away after the tapping stops. It's nothing that's going on inside your body because it's non-invasive. You haven't taken a medication. We haven't penetrated any part of your body. So those side effects are transient or kind of tied to right at the moment. So you have a profile that's very effective and very safe. So that certainly gives us a lot of excitement. Yes?
Can you use antidepressants along with treatment?
Excellent. That's a great question. Yes. So the question is, I'll get this right by the end. So the question was, can you remain on your medication or antidepressants and really having a lot of side effects? So their goal being, I want to feel better and I want to get off of at least a few of these medications. And so once treatment is done, we'll work with your psychiatrist, your provider, or our provider, whomever's you want to continue with, to look at that medication list and see what can be stepped off of. Great questions. Any other questions right here? Yes. Really just adjusting what already is going on in your brain, which is electronic flow between neurons, between the various areas of your brain. So neurostimulation is really about just elevating the brain's natural electrical activity. Does that hit it? One more question coming on.
As a follow-up, I just wonder if it changes the hormones that are affecting the, whatever the problem is, the thing that actually changes the synapses or whatever.
Yes, it's actually changing the synapses. So not so much focused in on the hormones, but more focused in on the ability for the fire and response of the synapses and the flexibility, meaning by creating that neuroplasticity, giving those synapses the ability to take a different path. So I used to go only this way. Oh, I could go this way. I could go this way. I could go that way. By having that flexibility, that neuroplasticity, that allows us to change our response to various stimulus. So it is the piece of the equation when we talk about those original three of, you mentioned hormones, that's coming from your body's ability to produce that feel-good hormone. This is going after the electrical components of the brain to allow it to be more malleable and respond in a broader range and reestablish healthy levels of activity. Going back to that picture of if we're looking at a brain that's depressed versus not, you'd be able to see on MRI imaging, this one's, going at a different level of activity and this one's kind of slower and depressed. Yes?
I actually have two questions, and one would take us backwards, so put it in wherever you want.
Okay.
But what you're describing sounds like it has some affinity to acupuncture in terms of the electrical circuitry.
Right, well, certainly acupuncture is about opening energy pathways, and energy is another word for electricity. So similar in that, so yes, but it's using a different method, a different path.
That's really interesting. And the other thing is, if you have time to go back to the gut health,
Yes.
I'd love to hear more about that.
Okay, I will circle back to that as it wraps in to the next section, so good prompt. Other questions right here. I'm gonna just cheat at my notes, see if I didn't make sure I didn't miss anything critical. Yeah, so kind of also, we started to talk about what does it look like and what does treatment look like. So another incredibly exciting component about TMS is how quickly we can get results. So the standard protocol, which was FDA approved in 2008, would be that you would come to an office like ours and receive a 20-minute treatment once a day for 36 days. That's still the standard protocol that most insurance companies pay for, reimburse for. So again, you would come and you would sit there, receive 20 minutes of treatment, then go about your day. There's no downtime, you can drive, you can return to work, whatever. So, but that's something that needs to happen every day for 36 days, largely next to each other. The FDA in the September of this year approved what's called the accelerated protocol. So kind of going back to the question over there, there's different frequencies that are delivered different rates, but an accelerated protocol for the simplest thing says we do a higher frequency treatment for 3 minutes, as many as 9 to 10 times a day. So what does that mean? That same 36 magic number can be achieved within 4 to 5 days. So if you think about this for an individual who's in an acute phase, who's not able to go to work, not able to really participate in their life, or has been struggling with this for decades, you now have something that has the ability to achieve results in as few as 5 days. Pretty incredible, pretty impossible to wrap your head around, but also very true. So that is, that's why we were just elated when FDA came out with the approval for the accelerated protocol, because that means insurance will, again, fall in line behind that and start covering it. Already we have 2 major plans that reimburse for the accelerated. So we're hopeful that that quickly spreads to all the other ones. Highmark, and then Blue Cross Blue Shield federal employee benefits. So, so a big one around here is a laggard, which is Independence Blue Cross Blue Shield, slow to market. Medicare, again, more progressive. They will do as many as 2 treatments a day, so that takes that 6 weeks down to 3 weeks. That's meaningful. But the most important thing is that both protocols have equal efficacy, meaning they work at the same rates. One's not better than the other in terms of what are the results. One's better than the other in terms of how quickly can I get those results. But even with the standard one, most people start to feel the impact of TMS after 8 to 10 treatments. So that's within, a week to 2 weeks, you're starting to feel better, feel the results. So even on the slow, steady as you go plan, it's still fairly fast response. Yep. Other questions here? Okay, I'm going to pop on to the next one. I think I might have gone to sleep on this. I don't think my cursor or my remote's working. Here we go. Okay, beyond, we focused mostly on mood disorders such as anxiety, depression, OCD, PTSD, because that's where the largest body of research is. The largest body of research gives us empirical data that says how well does it work and how effective is it and how long does it take? What's the exact protocol to get the results? So that's where insurance reimburses. The field, however, is quite expansive. So if we think about just about any neurological condition can benefit from TMS, from brain stimulation. So this can be things like mild cognitive impairment. So as we look at individuals who are in early set of dementia, onset of Alzheimer's, this taking your brain to the gym concept slows that process, reduces the symptoms, increases cognitive function, focus, and energy. It's also showing effectiveness in Parkinson's, fibromyalgia, pain management, and then, of course, stroke recovery we'll talk about in a little bit as well. The exciting part is, as with most areas of technology, the research body is growing fast and fast. Now that there's more and more clinics that have TMS out in the field, we're able to collect more data, we're able to organize better studies, and so these other areas will also, they're queued up in line for FDA indications. Once we have FDA indications, that leads to insurance reimbursement. In the meantime, without insurance reimbursement, we are still able to reduce symptoms. So for many of these other conditions, such as stroke recovery, autism, Parkinson's, we don't talk about remission. We talk about TMS fitting in with a comprehensive treatment plan that allows those symptoms to be improved, reduce the intensity, improve overall ability for cognitive ability and focus, things like that. So little different than the remission model of where we're looking to cure it and remove it, and more about how do we improve the lives of people living with those conditions and use TMS as the piece that's addressing the neuro circuitry level. So that, yes?
Listing several things. What about epilepsy?
So epilepsy is a super tricky one, but the answer is yes, but has to be delivered by a clinic that only specializes in epilepsy, because there is the opportunity or the chance of provoking a seizure from the treatment. So that individual would need to be on epilepsy medicine that's been stabilized, so showing that their seizures are under control. But it is effective in treating it as well. It just takes, you need to go to a special facility that's trained explicitly in the care for epilepsy. Mm-hmm. Yes?
Because I'm personally affected by it.
What about vertigo? Has any work been done?
So no information specifically on vertigo, because vertigo is more about the organization of the pieces in your ears and their ability to get out of alignment. So it's not the same as a neurological condition that's resulting as some sort of trauma or impact to the brain itself. So there's a little bit of a difference there. So there's I'm not familiar with any research in combination with other standard treatments for Parkinson's. In combination with other standard treatments for Parkinson's. So it's lessening those symptoms and delaying further onset. And one of the things that is so relevant here that will come up in our case study is that when we talk about all of these other conditions that are considered to be off-label, meaning we might have been treating someone for depression and, oh, look, their pain, their fibromyalgia went away. Oh, look, their migraines stopped. Let's dig into that more, is kind of what the history of the field is we're doing this and seeing this as well. Well, that's really powerful in two regards. When you have a chronic condition, often the treatment plan is heavily dependent also on other interventions such as PT, OT, and the ability to go about doing those interventions that are recommended right now today. So if we talk about the onset of depression coming in as a result of the challenge of living with a chronic condition, when we look at TMS, you have the ability to do two things. One, lift the depression, which in and of itself is worthy, but two, that lack of depression allows the individual to have the motivation to apply themselves in the areas of physical therapy and go to all the appointments that they need to go to and do the healthy eating that they're being asked to. So, again, one enforcing the other, and that's why the integrative model to me is so important, is that, to just strip one out by itself and say this is the answer or this is the answer only gets us this far in how much healing or how much improvement can we get. But when we start to understand how the dynamic of interplay comes to be, and we are supporting the individual across those different areas with different interventions, then the outcomes elevate from a multitude of angles. Yes?
And from a physical therapy perspective, looking at it from the other lens, we frequently educate patients on the fact that your mental health can actually make your pain worse, because pain comes from the brain. Your brain sorts all the information, decides that you have something different, and gives you pain to make you pay attention to it. But your mood can make it worse. So if you can lift that depression, you're not going to feel as much pain.
100%. And what we tell ourselves, again, is forming those pain response pathways. So when we talked about the neuroplasticity and those the synapses firing in a certain direction, oh, I feel pain, oh, I feel pain, oh, I feel pain, you become entrenched in that. And not that the pain stimulus wasn't there, but we've created a neural pathway that reinforces that. And so by applying the physical therapy, that's literally loosening the areas that might be causing pain from a ligament or muscle tension, loosening it up here with the neuroplasticity of allowing that pathway to become less worn, and then addressing it through talk therapy, where we learn to manage and process that pain feeling in ways that don't allow it to further set in. So all of those coming together is exactly it. They're reinforcing and become order of magnitude more effective when they work together in concert. Yes. Thanks, Matt.
Two other conditions I'm curious if it works at all for ADHD and addiction recovery.
So addiction recovery actually has FDA clearance for. And so what that means is it is used in recovery centers in order to address the neurological response that's happening with addiction. So it's part of a comprehensive addiction recovery plan. I wouldn't say necessarily like that's all you have to do, but it is an effective part of it. And then ADHD is another area that is in line for FDA indication. Some of that is A little bit of work that needs to be done on the front end to understand the chicken and the egg, if you will, because I think I mentioned earlier that each plan is an individualized treatment plan that's based on two things. One, what condition are we treating? That's going to tell us where in the brain to focus, and then where is that present for you? So a lot of people have two conditions. One of them is the genuine one that is, when I say genuine, I mean that's the one that's reflective of the brain neuroactivity. The other one is the response of having this one. So if you think of like anxious depression, somebody might think that they have OCD because they have to have things a certain way. But if we peel back that onion a little bit on the diagnostic side, we find out that they have things a certain way because they're anxious that if it's not that, I'm not going to be able to handle it. So really the condition that we need to treat is anxiety, not OCD. ADHD falls into that category of needing to have a good understanding of that individual's history to understand chicken egg. And so that we treat the right condition first and then see what symptoms are left after we remove the piece that was provoking that condition. If that makes sense. But the answer is yes, and it's in line for FDA indications. Other questions? No? Okay. All right, so we talked about beyond depression. So all these other areas are called off-level. When we think of them, that means 100% out-of-pocket private pay. Unfortunately, insurance doesn't contribute at all into the areas that are FDA cleared for this particular treatment. So I think this group did an excellent job of all the frequently asked questions. I planted questions in case we weren't as interactive as I hope we are. So I might just breeze through these. I don't think we really didn't cover any of them. So we also hit on a lot. We spent a lot of time talking about this as well, which is the importance of the integrative care model. And that's really the cornerstone of MooreWays, is to be able to have people that are credentialed at the highest level of their field in each of these areas to work together and have the best outcomes overall. The question to go back to that came up a little earlier was gut health. Tell us more about what that looks like. So our gut health program at MooreWays is based on something that's called the 5R protocol, which is to establish gut health restoration. So we're going to remove things that are contributing to inflammation or gut health disbalance. We're going to replace them with whatever supplementation or nutrients that are missing, and then rebuild that gut lining and re-inoculate. So how does all of that happen? So we use a tool, a diagnostic tool from an outside laboratory, which is called a GI map. And basically this gives a very personalized view of what the status of your gut health is. Is there overgrowth, undergrowth? Are there viruses? Are there parasites? You hate to think about it, but that's the reality. Are you deficient in certain micro or macronutrients? And all of that information, there's 230 factors. You could have sensitivity to gluten, not be celiac, but have an immune response to gluten or other food triggers. All of that information allows us to build a highly personalized plan that's not quick. It usually takes 4 to 8 weeks to really start to get the results and benefits of launching into a gut health restoration. But over time, repairing the integrity of your gut health lining prevents that leaky gut that we are starting to hear about more and more, and also makes sure that their gut's in a place where it can produce the appropriate amount of those feel-good hormones. So that's a little bit about how that program works. There's the initial diagnostic phase, and then you work with a coach to implement the repair phase. So, yes.
How much of the diagnostic stuff is covered by insurance?
So if you come to us and order, we order it on your behalf, the answer is 0. If you have usually it's a GI history where you've been seeing a gastroenterologist or maybe a endocrinologist for various autoimmune concerns, that provider can order it on your behalf, and it usually can be paid because there's a pre-existing history that supports the need for it, and so insurance will reimburse it, the tests, the labs, through them, if you have a provider who's willing to order that on your behalf. But otherwise, it's about $350 reimbursed by insurance.
What's been the most significant results you've got simply by addressing the gut biome as opposed to doing TMS therapy?
Yeah, and I see this a lot in younger people, and it's not because it doesn't work in older people, but that's the population that we've had the most success with this sort of overnight, near overnight results. So individuals with headaches, stomach aches, you go and get all the labs done, you're fine. They're like, I just don't understand this. But our bodies don't have the ability to handle those foreign matters. And so we basically launch an autoimmune response, immune response against them, and it can trigger a whole bunch of things, including very bad moods and mood swings. So I would say that's probably that area of finding people who have those severe sensitivities to preservatives. I mean, none of us should be consuming too many of them or any of them, but some people have an extreme sensitivity to food colors and preservatives, et cetera. Yes?
So you're going to talk about stroke, and I just want to make sure we only have a couple minutes.
Yep. Okay. All right. Let's click in. So, all of this data and statistics and everything, it's important, but none of it matters as it compares to how does it help people. What's the real story? What are people saying? So, our very own Pastor Sue. As I mentioned at the beginning, Bob and I have been members of the church way back when, and Sue has been a very important person to us. And when she suffered this stroke and was impacted both in speech as well as physical aspects, our hearts just went out all the time to what a struggle that must be. And when my partner and I transitioned into this field, expanded our field to include TMS, and reviewing the literature, reviewing the case studies of what's coming up next, stroke kept coming up, and we're like, we gotta see if it's gonna help. And as anyone who knows about stroke knows that the best time to get the best impact is as soon as after the stroke as possible. In the case of Pastor Sue, it's 4 years later when we got together on this front of TMS. But she was able to participate in that accelerated program that we talked about, and a couple of things, surprising things happened. We went into it saying, it's been 4 years, I don't know, but if it could do anything, wouldn't we all be happier? And of course, Pastor Sue's indelible spirit is like, let's try, let's go, giddy up. And so she came to the office every day and went through long days of treatment, and a few things surprising, some things not surprising, but at first it was almost instant after, because she was doing accelerated, she was getting like 4 or 5 treatments a day. After 2 or 3 days, I'm sleeping better, my mood is brighter, I'm walking out, I'm like, oh look, the sky is actually blue. The sun does shine. And this lift of a weight that she didn't even really realize she was carrying so heavily was lifted. So that in and of itself was worth the price of admission if you from my perspective, and I imagine somewhat to Pastor Sue's as well. But then come the weekend, she had a full schedule of her other therapies, which include PT as well as OT. And one of them is a pool therapy, and we were not at all targeting mobility because that was not something that was severely compromised compared to speech. But lo and behold, when I'm doing freestyle stroke, used to be arm could only come across here. Now my arm can come over and do a whole stroke, a whole swimming stroke. And she's saying, I'm swimming. My legs are kicking and staying up behind me, and my arm is coming all the way over. And we were like, okay, we weren't going for that, but we will take that. Yay. And then the third piece, which we were going for, and I'll try to keep it together here. The beginning conversations were a word, wait, a word. 3-4 days in, we are talking about our children, we are talking about work, we're talking about life, and the words are coming much faster together. Still limitations, still a lot of work on Pastor Sue's part to pull all that together and to muscle it. But we're having a conversation that's going at a clip that's more reflective of normal conversation. Well, what does that mean? Because you could say, well, I'm still not able to fully speak or do this. But now she speaks to people who don't know her history and who can now follow along with the conversation, opening up to subtle chit-chat with neighbors as they walk. And, we continue to go safe. As long as we're getting benefit, we're continuing, and the results and the outcomes continue to go as well. So we don't know where the end of it is, but we do know that that it has had a very positive impact. And I'm so grateful that Pastor Sue allows me to share her story, because it does speak to both sides of it. The part we know about, which is depression, and how big of an influence that had on her ability to apply herself. She would say, I'm practicing all day. I go home, I do my writing, I do my speech, I practice, because I feel so good. So those two pieces really playing off of each other in a way that let the results come.
Thank you so much.
No, thank you. Thank you. So I would just say, I think we've hit our time here. Again, thank you guys for coming and listening and asking all these great questions. I appreciate it. I encourage you, I'll leave my cards and information here. Please just call, reach out for a conversation. If you have someone in mind that's struggling, that you would think could benefit for this, we can do a consultation for free in the office, see what it looks like, demystify, whatever it takes. But I just encourage you to please advocate for those in our world that are living with these conditions and not getting results, and give us a call, and we'll do our best.
Thank you so much, Diane. Thank you, everybody, for sticking around for this important conversation, and thank you to our adult education team for making these things happen. We'll be looking forward to future forums. We don't have one coming up as we go into Lent, but stay tuned for more from the adult ed team. If you'd like to be a part of that team, let me know, and we'll be glad to include you. Or if you have ideas, especially if they come with here's the way we can get to that idea. We really that's how all these great forums really have come together this year. So yeah, if you want to learn more about MooreWays, I'll have Diane's information to get it to you. They're very easy to find online. If you just remember that Moore has 2 O's in it, and you can find them directly as well. Again, thank you very much. Thank you to everyone who joined online. Hope you have a great day.